the next session. Welcome back. I'm excited to have you here, and together with me, I have Dr. Sahar Nassirpour. Why we did this session and this panel was because we are partnering, WSA is partnering since many years with EIT Health. EIT is a European institution of technology, and they are focusing on different topics such as health tech, digitalization, mobility, climate, health tech. I think all of us realized also during the pandemic how important health tech entrepreneurship, innovation in health is. And we were together with EIT and our partner, we were very interested. Is there a certain perspective that we have to understand and that we have to see and approach health tech and health tech entrepreneurship through a gender lens? Dr. Sahar, over to you. Very happy to have you here, and I'm really looking forward to these conversations.
Thank you very much for the introduction. It's my pleasure to be here today. According to a recent Forbes article, women make up over 70% of the healthcare workforce globally. Yet they are severely underrepresented on the leadership level. In fact, only 9% of health tech startups are founded by women, and women make up only 11% of partners in health tech companies. Today, we are going to hear from 4 panelists who each in their own way are contributing to a very different future for health tech diversity in Europe. And together, we are going to explore whether or not taking a gender lens to health tech entrepreneurship could be beneficial. Together with me today, I have our 4 panelists. Ivana Kostic, co-founder of Healthtech Lab, Erin Webb, co-founder of Advocence, Emily Jordan, co-founder of Ancora.AI, and Özge Karakas, co-founder of Heidi Imaging. It's a pleasure to have you all here with me today. So let's just dive right in. My first question is for Emily. When people hear technology, they often think about computers. And since computers are not humans, they think, how can there be bias in technology? Your company, Ancora, is trying to diversify and democratize clinical research. So could you please tell us more about your company, and also tell us, in your experience, how can clinical research be biased?
Sure, it's a really great question. I think in terms of how underrepresentation can impact medicine, the way that it's developed, and ultimately the safety and efficacy of medicine when it reaches the wider population. So our company, Ancora.AI, aims to make it easier for every patient to access research. So it simplifies the information, standardizes the way it's presented, and makes it searchable in minutes to find a clinical trial or research study, rather than something that usually takes even physicians or expert scientists many hours of research. A couple of examples of why this is important. So depending on the kind of background you have and your level of expertise, it may be harder for certain people to access trials. So for example, if you have to research what treatments are available to you, if you don't really have a good medical understanding, you rely on your physicians. Physicians have very little time, and unless you're at a major academic research center, they're not going to really look at trials because they don't have time. This means, as you can imagine, that the actual population of people that participates in clinical research traditionally has been really, really biased. Racially, in terms of gender, in terms of socioeconomic background, education level, people with disabilities. Typically, it's white men of middle age that are participating in these trials. And one great example that I love is the development of the sleeping pill Ambien. The trials were conducted mainly in men in the 90s. And after a few years the drug was on the market, they realized that it's metabolized differently in women, and it had been causing like car crashes and terrible accidents disproportionately in women, because not just the body size issue, but because their bodies were actually breaking down the drug in a different way. So it's a great example of why it's so important that we have gender diversity in clinical development. So we're tackling the first step of that, which is actually helping people access even the option of clinical trials and understanding the information. And I think you have to look through this lens of diversity when you approach drug development in any context, because otherwise you get medicines that aren't safe and may not work.
What a great example. And yeah, that really showcases how important it is on a technical level to think about this. And I want to really emphasize the risk of development in health tech not being inclusive. Erin, your company is on its way to transform geriatric care. Can you tell us a little bit more about that? And then tell us, in your experience, what are the risks of not being inclusive when developing a product such as yours?
Yeah, thank you so much for this question. So our product, the census system, is aiming to monitor incontinence, and it provides a real-time notification when a patient or a nursing home resident becomes wet to enable clinicians such as nurses or other care staff to have the information that they need to know when a patient needs to be changed. And when I think of gender and how that impacts the development of our technology, it's interesting because of when we think of healthcare settings, there's multiple users of our product. There's the clinician user that is generally the nurse or other trained staff. And there's also the patient users. And so there's a gender lens that needs to be applied at both levels. So at the patient level, it's actually more common to have incontinence in women. So 1 in 3 women over the age of 65 have some sort of urinary incontinence. And then at the user level, it's more often, as you said in your opening remarks, that healthcare staff are women. And especially there's a difference maybe between different types of healthcare professionals. So it may be that health technology is more commonly developed for doctors rather than nurses, or the types of value is kind of not as emphasized if it can be helping nurses with care needs. And that's something that we want to change as Advocence, and advocating for both the patients and the nurses is really important to us as we develop our health technology.
Great. Then Ivana, I know that your company is trying to develop an ecosystem for all stakeholders in health tech. So that means that you're probably dealing with different levels of health tech entrepreneurship. In your experience, all the stakeholders, are they aware of the importance of these issues? How do we have discussions like this between all the stakeholders? And yeah, tell us a little bit more about that in your experience.
Thank you. Thank you so much for the opportunity. Hello from Belgrade, Serbia. Healthclub is a health tech ecosystem of Serbia. So there is a huge innovation gap among the countries in the world, where there is no opportunities for the developing countries to develop their own innovations in their own ecosystems. So therefore, we are creating the missing linkages and then connecting the existing ones currently in the ecosystem of Serbia. So we are gathering everyone in order actually to boost the ecosystem and make the startups and innovations in this area in Serbia flourish. We won recently from the International Telecommunication Union Best Ecosystem Practice Award, and it actually supports our idea that models and everything actually that we do and expertise that we have in Serbia to actually spread it in other ecosystems of other developing countries. So the idea is actually to make Healthclub chapters in developing countries and make the global network. So basically, we work on global expertise, meaning that you have local challenges that could be through this ecosystem solved and then transferring the experience globally. So as connecting the ecosystem linkages, we do have a lot of experience in this, and there are challenges definitely that need to be overcome, especially in the gender field, which hopefully we will touch upon during the discussion.
Yeah, so to me, it sounds like a lot of these important issues could be improved by encouraging more females to take the leap and basically take the route of entrepreneurship. And since several of health tech startups in Europe have their roots in academia and deep tech, I wanted to ask Özge, as a spin-off company of ETH Zurich, how was it for you being in academia and making the decision to start your own company? What was the support like, and why is it, in your opinion,
Sarah, I lost you for a little bit. Can you please repeat the last part of your question?
Yeah, absolutely. Sorry about that. Can you hear me now?
Yes, I can hear you well right now.
Okay. I wanted to ask you, as a spin-off company, what was your experience making the decision to found the company, and why, in your opinion, fewer females make such decision compared to males?
Yeah, absolutely. Thank you for the question, Sarah. So maybe I'll give you a little bit of information about Heidi Imaging. So as you mentioned, we're a spin-off company from the EU, from Switzerland, and so with my colleague, after years of research, we decided to transfer our knowledge into clinical applications, and with that motivation, we started the company. And so what we do is we are a medtech software company. We provide software for hospitals for more efficient processes for the operation, so we can increase the efficiency in the hospitals and also improve the operational outcomes. We were two colleagues working at ETH in our research, and so during that time we can really have dive into applications and increase value in the hospitals. And it was our motivation to start our company. And from the university, and the ecosystem in Switzerland, we also have a lot of support. So there's support from EU and the country as well for female entrepreneurs and entrepreneurs in general, and for deep tech entrepreneurs. And with that support, it was quite easy and straightforward to translate our technology into a startup.
That's great. Can you maybe tell us, in your experience, as a follow-up question, why is it that fewer, for example, did you notice this in your colleagues, that is it that fewer females are choose such majors in academia, or that fewer females make the decision to found the company? Where do you think is the gap that we see more of the male involved in academia making this decision to found a company after their studies?
Yeah, so in academia, we see decreasing number of women from bachelor's to master's to PhD, and going into the professorship as well. So every time we have the what we call the leaky pipeline, right? So the number of women decreases over time. So that's one problem that we see. But when we look at the numbers, we see over the years that we have more and more women included in startups. However, it's not enough, so we need to increase these numbers. And with this women leadership increasing over time, I think we will increase the motivation for future leaders.
Yeah, let's all hope that that is the case. Regarding female entrepreneurship, I want to dive now a little bit deeper into the kind of support and encouragement we can all look for, or for maybe young innovators who are looking for that. My next question is therefore for Erin. You attribute the origin of your startup to participate in Female Health Hackathon in 2018 together with your co-founder. I wanted to ask you to maybe share a little bit of your experience participating in this event, and how did taking part in such an event lead to the birth of your company?
Yeah, thank you for that question. It's always fun to reflect on the beginnings of the journey. So my co-founder, Martina, has been a nurse for over 10 years, specialized in emergency nursing and geriatrics. And she saw an advertisement for this event. It was Hacking Female Health, and they had different themes about different types of health challenges that more often affect women than men. And so incontinence was one of those challenges. And Martina and I went to this event just in mind to network and to possibly meet other people in the health ecosystem in Berlin. We had more recently moved to Germany, and so we're kind of seeing this as an opportunity. And I think the way that the hackathon was organized as, targeting female types of health related issues, and that made it really more interesting for us to join. And at that weekend, there was a fairly even distribution of men and women. And we've heard from organizers that in the past, these types of hackathon events are mainly targeted, or it's more often that men would attend than women. And so I think that the way that these events are marketed and set up makes a difference for who will attend, and also the excitement that women such as Martina and myself would have to join. And it's also interesting to reflect on, a hackathon as the start of a company. I think that's not always where the ideas that come out of these intense long weekends go to. But it is a testament that maybe with having this type of supporting networks afterwards, these types of ideas can continue even after just one time.
Absolutely. And in line with that, just for our audience to also get familiarized more with where to turn for support, for founding, or even for growth, I want to ask Emily if you've ever taken part to in such female founder-oriented events, and what has been your personal takeaway from them?
Absolutely. I think it's been really encouraging the past few years. I've seen a lot more of these types of programs pop up, specifically targeting female entrepreneurs, especially at the early stages, which is so important, and offering also networking opportunities with investors early on. So I've attended several investor roundtables. Really during the pandemic, a lot of this had to go virtual, but it has continued. And I think the biggest kind of value add for my journey as a female founder so far has been a program that I completed with Google. So Google for Startups has a program in Europe that has specifically, I think for the past 2 or 3 years, focused on female entrepreneurs. And that was a great program. They have a strong alumni network as well. We're still in touch regularly. We were meant to have an event next week, actually, but of course that's now canceled due to the pandemic surge. I would say that's been a huge benefit, and we've accessed some executive coaching through that. I think my token of wisdom, having applied and participated in many of these programs, would be to stay away from any programs that take equity or any programs that are charging female founders. We have seen a couple of maybe I would call shady practices there, and I really think to be a strong program and to really offer value to female founders, nobody should be taking anything from you, especially at a very early stage in the company, unless they're investing cash in your business. And there are a lot of very shiny, nicely marketed programs out there, ostensibly for female founders. I just really don't think that's fair. And I think to really see growth in this area, there should be free services, and investment should be made into this space to really encourage women to build their own companies and to leave the ownership with founders as well as long as possible.
Very important indeed. Thank you for highlighting that. Özge, I think you also participated in EIT Health Women Entrepreneurship Bootcamp. Maybe tell us a little bit more about that. What kind of support did you get there?
Yeah, absolutely. So EIT Women Entrepreneurship Bootcamp started last year, and when I saw the announcement, I thought that it's a very good fit, and I applied for it, and luckily I got accepted. So it was a 6-week-long program with classes and coaching and mentoring, and also we had time to interact with the other startups, other coaches over this time, and there was a lot of support. We were quite happy about that. And the reason that I wanted to be involved in that is that I think for women entrepreneurs, for all of us, we have this duty to contribute to the society and contribute to the system as well. So it's like we have this community and we learn from it, but also we contribute to this community. And that was my idea to join that. And I really think that it was very, very useful for me. And I really encourage everyone to join this program.
Great. And Ivana, as a company that is fostering this ecosystem, how is Healthtech Labs planning to kind of, do you offer such events and such support yourself, or how do you see you contributing to this?
Yes, thank you. So I would stress here first that I think all the gender issues that are occurring in tech, in science, in innovations in general are really community and geography based. So I would also recommend a great movie, Picture a Scientist, which really explains through specific examples of US gender bias in these areas. And I think it's important to stress that it's a great example and that everyone should see it, also because it explains bias in general, of race bias and others, and how it works and why it happens, even with people who are really aware about the topic. but also that it's really crucial to gather your own community and see the local challenges, because otherwise if we see, from another communities, the challenges, we may say, well, this does not exist in our community, so it does not exist at all. And therefore, I think this is the main conclusion of how to tackle this issue. So this is something that we will definitely implement in Healthclub, and we are supporting the scientists and female entrepreneurs. So through these community events, we really gathered experiences and challenges that they're facing, and we're trying on the policy level and other levels to improve and to somehow fix this for future improvements. And I would say the majority is actually facing this issue with the lack of time due to the actually commitments in science, in research, in entrepreneurship, but then mostly because they're also mothers. So motherhood and entrepreneurship, it's really not well described on a policy level, on laws level, and this is really focused these days in our own community. So I'm again stressing this is our local challenge that is being tackled these days.
Very important point about the family aspect of it. Thank you so much for bringing that up. And yeah, thank you all for kind of sharing your personal experience on your entrepreneurship journey. And now maybe let's dive deeper into the more discussion part of this, where issues that I'm sure faces all of us as female founders. Arguably, the single biggest one of those challenges would be fundraising. And I wanted to ask you all to weigh in about this issue, your experience with it. What has been the biggest challenge or biggest factor contributing to your success? And maybe, Erin, we begin with you.
Sure. So Advosense is an early stage startup, and it's a highly regulated industry that's difficult to get access to. The healthcare space, especially with COVID-19, is relatively closed for good reasons, because you need to prevent types of infection and transmission. And so we've received a lot of no's from a lot of investors, and it's difficult to tell whether these no's are because of our stage of a company or for some sort of gender bias. I received feedback earlier in my career that I don't present as confident, or that I couldn't be a leader based on the type of more less assertive personality. And I think that these things need to be challenged, and it's always hard to tell where the no is coming from. And also when you see other people getting yeses who maybe don't have the same level of maturity. So the way that we've gotten around that as Advosense is each of the founding team kind of has other ways to support themselves. And we've also been very successful with grants. But it's something that I'm curious to hear others in the panel as well reflect on this topic.
Absolutely, me too. Emily, would you like to share your experience?
Sure, yeah. It's definitely a challenge, and I think the issues that Erin brought up are so true. Some of the feedback is often hard to parse. I'm sure that's the same for every founder, but as a female founder, there's another layer on top to really think about, especially in technology, I would say. Like Erin, we are fairly early stage. We bootstrapped for more than 2 years. We were also very successful with grants. I think Erin and I actually met previously because we were both recipients of the EIT Head Start grant, which was really, really a turning point for our company. And we've also received some other equity-free grants. So I would encourage, especially in health tech, this is a great route for early stage companies to keep equity and to fund the company. The good news is we recently at Ancora.AI, we closed our first financing round in October. So we're fresh out of the investment process. I would say our challenges, it's also hard to say what was gender and what was just the industry and the pandemic. We also, like everyone, received a lot of no's. They say you have to have 100 meetings to receive 1 yes. I would say that statistic is probably true. We were tracking that as well. Health tech is hard because you have to have expertise and you have to know the industry. And sometimes investors, unless they're very skilled within that industry, find it too complicated. And I think that's a turnoff for them, especially listening to kind of younger women explaining something complicated to them. Sometimes they don't necessarily believe it. So I would say that the kind of strategy that we had as founders, I have two co-founders, one male and one female. We didn't found the company when we were 22 and fresh out of undergrad. We all three have a lot of work experience and a lot of life experience behind us. And I think that has given us the skills to bootstrap for so long and support the company, and also the skills to be confident in those meetings. I wish in hindsight, I would have been brave enough and confident enough to start my founder journey earlier, because it's really, I mean, I think it's intimidating to a lot of people. I think women maybe tend to wait a little bit later to start. I don't think that should be the case. I would also say for just meeting investors, everyone will tell you when you start looking at the VC route that everything is about warm intros. So having an introduction to that, you don't just cold call up a bunch of investors. My perception is that a lot of female founders have a less warm network. So we have a couple of more degrees removed, you know, to get through to the people that we want to speak to. And when I look at the investors that participated in our successful round for our pre-seed, they were all very, very warm intros. So it was people who knew us well, who we've worked with previously, or who were connected for someone who could really vouch for us as people, as founders. So that is really important. And I think until the investor ecosystem also becomes more diverse, it is a little bit of an uphill battle for many women.
Yeah, very well said. Maybe Özge and Ivana, if you could share, maybe we can also, Özge, you can start.
Yeah, of course. So I agree with most of the comments that have been done before me. And so definitely for an early stage health tech company, fundraising is a challenge. And especially during the COVID time, being a woman, so there are several factors that are coming in. And right now for me also, it's very hard to say if it's COVID, if it's I'm a woman, or if it's like very high technology, that's very like harder to explain. But definitely it was a challenge. We started the company just before COVID, and we started our first fundraising round in the middle of COVID. And so during that time, like I did some research as well about women fundraising, and so maybe you guys know about it, but last year Crunchbase, looking at their database, they published a report looking at the startups and their fundraising rounds, and they found that about 45% of the companies are women-led, or at least they have one woman in their founding team. And when they looked at the VC funding, 91% of all the companies that did the fundraising are only men. About 67% have at least one woman co-founder, and around 2% are all women co-founders. So it means that if you have at least one woman in your team, then you have 90% less chance of fundraising. So this data is, we need to change this data, that's for sure. So we need to increase our presence, and we need to change the way that the decision makers look at us, that's for sure. And also there's this TED talk from a researcher, and it's called Why Women Entrepreneurs Have Less Funding, and I recommend it for everyone. And very briefly, I can explain that. So this researcher looks at the conversations between the decision makers of the fundraisers and the women startups and the male founders startups. And she's looking at the different words, and she says there are some negative words and positive words that they are using. And she finds that for women, the investors use more negative words. Negative words meaning that, okay, what are the risks? What could be the problems? What could go wrong? So these kind of questions are being asked to women entrepreneurs. And while looking at male entrepreneurs, they ask, okay, how big we can go? How can you grow? Where can you go? So these kind of questions could be also changing the decision-making process. So what we can do during that time is to identify how the conversation is going, and then also talk about, okay, these are the risks, but these are also the gains. So that's how we can grow, that's where we can go, and these are the milestones that we can achieve so that we can contribute to the society. So that's one way, and this is one way that we are also talking with our investors, and we see that it's also going in a positive way.
What an interesting insight with the research on the words that investors use while questioning founders. Definitely attests to the fact that there is implicit biases. And Ivana, how has been your experience?
Yes, I would start from a bigger picture of health tech in general. I would say it's challenging and with a lot of risk for both males and females. So it takes, for health tech, a little less, but still, yes, it takes a lot of time for development, a lot of investments, a lot of risk involved. And so I think it's really challenging for any gender. And of course, if you put females with all the named issues, it gets even harder. When we talk about developing countries and us as Healthclub, enabling funding for us as an organization and also for startups, it's also a challenge for itself, right? Because of our geography. So it's actually the first challenge that we are tackling within the Healthclub, also for all startups, led by males or females. And therefore, we are pretty aware of what is going on and how the challenge is going. And this is just another layer of gender issues that we may have. So currently, there are state funds within the Innovation Fund. The private funding is getting ready, so we're really boosting the whole ecosystem. But I would also cite at this point a book, Lean In, from Sheryl Sandberg, that actually focuses and explains pretty well the two types of issues that female founders have. And these are some internal challenges that they face and that they should resolve, and also some external factors that are actually depending on geography or local community. So basically, I would say that working on both of those challenges, it's really crucial of actually tackling your own female leadership skills. So whether in health tech or in any other entrepreneurship field. So basically, being more confident also in those meetings in front of investors and so on. And one of the typical questions actually that, as I mentioned, our leaders in health tech, female leaders have, it's usually again connected to the motherhood. And for example, investor would ask in advance, when do you plan to get pregnant? So this is one of the questions that they really get often. But of course, there are solutions to this. It's also important to connect with other females, with more experienced females in the community that can give you feedback or some kind of advice of how to react in those specific situations.
Yeah, excellent point. So going towards a more hopeful future, I want to talk about next steps, and maybe we start from the bottom up. And we will, of course, talk about, because many of you mentioned that grant support has been a big help. And we will talk about policy on that level and also among private equity. But starting from the bottom, right? What could each of you weigh in about whether or not, as you head towards the growth stage of your company, whether or not you have diversity and inclusion goals in mind? How do you set the right goals and how do you enforce them? Maybe we can start with you, Emily.
Sure. So I would say this has been something that's very top of mind for our company as we grow. Right now, we are about 11 people in the team, and we're growing swiftly. So we've been very careful about building a company culture that is inclusive and also kind. We like being nice people. And we're committed to building a team that is both gender balanced as well as diverse on other aspects as well. This is really important. It's not just because we're good people and this is the right thing to do, which it is, but it's also because we're building a product, which, as I explained before, is really aimed at democratizing access to a type of information that most people haven't dealt with before. And if you want to build a product that serves every type of patient well, you have to confront these biases early on. You have to have a team that understands the perspective of these different types of users that we're encountering. So I would say so far we've been successful with that. I think having females at the management level, so we're 2 out of 3 females and we're all 3 feminists, has been really important as we do outreach. So we also when we list jobs, we make sure to distribute them through certain networks. So there's a few I can mention. I think Tech Founderland is a good one. Black in Tech, we've listed with them. There's one that's great. It's called like Working Moms, I think, which is for women who have kids and are getting back into the workforce. And so I think having faced biases in our careers as women in health, we are well placed to design and foster a culture that avoids some of these problems, and we're conscious of that. I think that it's not only, like I said, good for for us as in terms of a working environment, but it's also a better strategy for our product overall. And just I wanted to note as well, just on the issue of women specifically around having families, it's been brought up a couple of times. I think the other thing that's really important for diversity, and especially at the founder level, is having examples of women who have made this work. And I think that representation and having role models is so important. I actually started Ancora.AI after having one kid already, and then I really jumped in full-time after having the second kid. So I would definitely not have made that leap unless I had a couple of conversations early on with a founder who I knew from a previous life who had 2 kids and had successfully raised venture capital and was growing her team and was making it work. And she was kind enough to have a phone conversation with me. And now if I ever have anyone in my network who wants to have that conversation, I'm always very motivated to try to be that example as well. And that really gave me confidence to move forward. And I can't emphasize enough how important that is. And I think that's something that often men or people in positions of traditional power don't necessarily understand, that just simply being able to look at someone who is in your shoes and has made it work, it really makes a difference.
That's a great point. I can also personally attest to that. For me, it was the same, seeing female entrepreneur making it work on all levels, family, work, and successfully leading the startup. What was put the seed in my mind to start my own company. So I do really appreciate your point here. Before we get too far from the previous topic of fundraising, I have 2 questions from the audience, which I think we can answer before we move on more on the next steps and solutions. So firstly, for Ivana, I think you said that VCs ask, oh, when do you plan to get pregnant? And people are asking, what is the most effective answer? I mean, given the fact that I don't think that question should be even legal to ask, but this is what the audience wants to know from you.
I think, yeah, it's a good question. I didn't say that. So one of the co-founders that actually had this issue had a great team. So she said, if I'm not able to use the funding in appropriate way, there is a co-founder or a team or group of people who can actually do that, even if I'm not available at the time. So this is one of the possible answers, but I'm sure there are more possibilities. But definitely the team and the secure grounding without risk is something that investors like to hear.
That makes sense. And maybe a follow-up question for whoever wants to take this. The audience is asking, how can women take advantage of the stereotypical attributed gender role characteristics, such as the caring nature, emotional side, in order to use it to their advantage and secure funding and convince investors? So if anyone wants to take that, please feel free.
I can do a first answer for this. So I think that when it comes to kind of, I wouldn't necessarily say like using specific characteristics to advantage, but I think track record is very important, like demonstrating that, you have a certain way of working and that it can be successful is the best way to sort of break the stereotypes that you need certain characteristics to be successful. So when I talked about a former coworker saying I could never reach a leadership position, that was more motivating than anything to say, I can reach this leadership position. Yes, I'm just an intern at your company. But as I've progressed in my career as well, it's always kind of like having that seed in your mind to motivate as an individual to break those stereotypes by showing up and continuing to work on it every day.
Yes, very true. So then maybe going back to what we were talking about before the questions came up, Özge, could you tell us a little bit, as you head towards the growth phase of your company, what are some creative ways to proactively source underrepresented candidates to fill up roles? What does that mean to you to have diversity and inclusion goals going forward with your company?
Yeah, absolutely. In our company, we definitely welcome diversity. So it can be age, gender, nationality, all kinds of diversity, because we think that we are stronger when we have more diverse team. And this is also for gender diversity. In many research, it was shown that when you have more women in the boardroom and more women in the leadership positions, economically, the companies are doing much better as well, right? So this is not only for society, but also like we will be more successful when we have more women, not only us, but for all the world economy when you think about it. So we are a technology company and we have a lot of software developers in our team. And when we have a job application, we usually have male applicants, many more than the female applicants. And of course, we treat everyone equally. And when we make decisions, we try to increase our diversity in our team. And looking at more general overview about the entrepreneurship and startup environment. So what we can do and what I'm trying to do is, as a female entrepreneur, I try to be there as much as possible and have my voice in many different events and also create a community. So when there's a female community with talking about the problems or talking about how we can, not only problems, right? So how we can increase the diversity, increase the inclusivity, I try to make myself available, be there, contribute, and learn from them. So I think for us, it's important to increase this representation and also have the voice. So go there, talk, and be present. So that's very important.
Great. And Erin, maybe do you have any, from your personal experience in your company, how do we foster a work environment that is more inclusive? I'm talking both about the culture, but also about the work conditions. Would you think it's important that we have certain flexibility when it comes to, the needs that women might have that is different from men, like working from home if they have children? And how do we basically foster that?
Yeah, so at the moment, we're only 3 co-founders. And we've been working remotely the entire pandemic. So I think that's also been a testament that these types of flexible working arrangements can work. And so as we grow in the future and, look to be more inclusive and have these types of things in mind, it's something that we will promote definitely as well. And the other thing that I would say around this topic is, I think the metrics of success will change. Also in health tech, we need to be close to the nurses and the clinicians. And so in order for our side, we need to have people with these types of experiences to be able to reach the customers. And because most nurses are women, this will be something that naturally comes, I think, as we grow our team.
Excellent. And Ivana, what is your take on this? I know that you touched upon the work-life balance for women. Anything about that you would like to add?
Yeah, I would like to start with this, that we lead by example in Healthclub, let's say. So our team, another co-founder is male, is a patient and an ex-president of Patient Association of Serbia. So we are completely opposite in almost all aspects, and we function pretty well. So I think that's the great example of inclusion and of cooperation and a team that is mixed, both male and female involved. So I would say that this example, and for us really functioning pretty well, is one of the examples of inclusion and overcoming all other biases. But I would also like to point out that promotion of girls and female entrepreneurship and good examples in general, it's pretty important. nominating them from the community to specific local and international events, awards, where World Summit Award is one of the examples, and it's a great contributor to our mission in Serbia on this topic as well, and definitely involving into several programs, good examples from your own community. I think it's really great. So me, myself, I was part of Women in Tech. It's already a global community, and at the time I won an award that is actually connected to Healthclub's activities, but also they're creating chapters and communities all over the world, which I think it's great initiative to be involved in. And also, let's say, choosing role models within World Summit Awards or another kind of initiative that contribute to that. So I think it's really a systemic way of resolving this, but also I think each one of us can contribute every day, for example, by supporting a girl or a scientist or entrepreneur from your own community, by mentoring them, or by connecting them to the mentors that you think could really, succeed or help them succeed and somehow speed up their success, and definitely contribute on that way as well.
Perfect, thank you. So more on the policy level, if we want to basically try to close the diversity gap in health tech in Europe, Emily, I know it's a debated topic, but what is your opinion about gender targeted funding on a policy level? Because I know some people say, well, then you're not looking at on a merit based, you're really just doing this gender targeted to make up for something, but it's not the best way to do it. What is your personal take on this?
Absolutely. I think it's an excellent tool to help to level the playing field. I think these arguments about this kind of targeted effort to help a certain population being unfair or kind of removing the meritocracy is totally unfounded. If you look at VC funding, which we've already discussed, it's heavily biased towards supporting male founders, typically female founders, especially all female teams, especially those that also have other diversity aspects, so are from underrepresented populations besides just being female, really don't have good access to that funding. And I think the health tech space is an excellent way to look at this, because if you look at health tech funding overall throughout the pandemic, there's been a huge spike in that funding. But if you look at the funding awarded to female founders, it actually significantly fell throughout 2020. So the pandemic made that worse. There's a lot of hypotheses about why, maybe actually not being able to be in the room with investors and have meetings remotely put women even more on the back foot. So I absolutely support efforts to provide equity-free public funding to female founders in a targeted way to help to level that playing field. If you look at graduates coming out of, especially in biological sciences, there's more and more women. Computer science, there's more and more women. I really don't buy this argument that those graduates and those people with ideas are less merited. And I would recommend to anyone in the audience to read this book, Invisible Women, about the data gap and kind of the problem with some of these arguments around the meritocracy and lack of affirmative action for women. So yeah, 100% support it.
Thank you. And Erin, in terms of closing the diversity gap on a policy level, do you think there is something beneficial about implementing key performance indicators in all relevant EU programs? Could that perhaps be of help, or anything else comes to mind?
I think it's an interesting idea to have these types of targets and thresholds as something that's linked to the ability to get funding or kind of just general market rewards, especially because there's this, very common saying, what gets measured gets managed. And as long as, I haven't read the book that Emily recommended, but as long as, as long as we're still asking the question of like, why is there this gender diversity gap and not doing things to try and fix it, then the more that you can implement sort of indicators to try and get sort of more of a detailed insight into why some of these are happening, will definitely help kind of moving forward.
Thank you. And Ivana, your take on this on a policy level, especially because I know you're fostering this ecosystem, so you must have certain things in mind to add to.
Yeah. So I completely agree with that, considering the grants and, let's say, state funding. But if we're talking about private funding, VCs and angels, I believe that these cannot be applied. So I think the approach would be more systemic or more social, or involving them, let's say, in different kind of events, and also probably organizing some kind of roundtables or discussions that could list all the problems and ways to de-risk, because the risk part is the major issue with this challenge, let's say. So private funding, in that sense, I would separate from the challenges of the state funding and grants and government funding, and I would say that's one way to look at that.
Excellent, thank you. And Özge, anything to add on being from the academia as a spin-off all the way to policy level for public funding or even private? Do you have anything else to share?
In terms of gender balance?
Correct. So what policies can be implemented on these different levels to balance that out?
Yeah, absolutely. So, well, looking at the entire system, so I dream of a world where we don't have any gender bias. So in venture capitals, all of the data shows 50-50% or very close percentages. So, in the future, I hope we will reach that so that we don't have to have like many different schemes in order to have this balance. But until then, I fully support all the policies and all the programs that support the women inclusivity and any sort of inclusivity, actually, so that we can increase the numbers and decrease the bias in all of the stakeholders. So from the academic perspective, definitely. So you asked me earlier about what could be the reason that women entrepreneurs and women researchers are less in number. So there could be many reasons. It could be cultural and stereotypical reasons, or it could be family reasons. So there are many reasons. Like, it's a very complex process, actually. So in order for us right now, it's our duty to close this gap, put more funding, put more time, put more support on women and any type of inclusivity. Basically, it can be age, it can be nationality, so that we have the balance for the future, so that we can have a more equal world.
Perfect, thank you. As we are approaching slowly the end of our time, I thought it would be interesting to ask each of you, if you could have one wish that was guaranteed to come true as a female entrepreneur regarding your entrepreneurship journey, and it can be about anything, what would it be? And maybe we start with whoever is ready, or feel free to jump in. Maybe Ivana, do you like to start? It can be anything, just to see what pain points is really on the top of your mind that people would like to hear about.
I have an idea, so I can volunteer to start. So we've talked a couple of times about or mentioned the importance of networks as being a way to ask kind of these questions that are difficult about, how you get funding or how you balance the family and the company. And I want to thank Emily, actually, because we had a conversation along these topics in the past. But the wish for me would be that we can ask these questions in public and not feel like we are negatively affected from the financial side, because we are having private conversations about them, which are helpful, and we can look privately to women who inspire us or other female entrepreneurs. But there is always this fear that if it's spoken out loud or self-proclaimed as a risk to the company, then it's something that is negatively seen later on if you're trying to get funding or grow your company. So that would be my wish.
Absolutely. What an excellent point. And I definitely think putting these things out there so that people, the right people can hear it, maybe foster an environment, events, that these things can be handled like that would benefit all of us greatly. I don't know.
I can
please go ahead. Yeah.
So as we noticed, we're all females panel here, and I think as females are minority in health tech entrepreneurship and science and tech, this is perfectly fine at this point to put all the focus on females. But I wish that in the next year, let's say we have at least one male in a conversation about women entrepreneurship, but then in a few years to have a mixed panel where we can discuss not only women entrepreneurship, but really focus on health, tech, and science. So that's it. A little wish.
Yeah, makes sense. Yeah. Very good. Well, in that case, if anybody has any closing remark to say, other than that, I would like to thank all of you for really opening up and sharing your personal experience on your entrepreneurship journey. I think for the audience, we've heard a lot about where to turn for support from the personal experience of our founders. Just knowing that there are role models like this out there, and sometimes help is just fingertips away, and reaching out and connecting, but also on a policy level, so that I'm sure EIT Health is taking steps towards this, but even more a greater scheme than that, to hopefully paint a very different future for health tech and diversity.
Thank you, Sahar, also from my side. Thanks for the moderation. I think it was extremely helpful to get this also very hands-on and very concrete recommendations from the panelists, be it in terms of funding, but also be it in terms of the support networks. So I think whoever is in health tech and entrepreneurship should definitely approach EIT Health, or Ivana, if you're working in Serbia, but also WSA can be a fantastic community to kind of meet like-minded people, get the support that you need, find mentors, find people who support you in your entrepreneurial journey and don't want to change you, but support you and the way you want to do your business, rather than scaling fast, but scaling in a way that is right for you and meeting your objectives. Thank you so much. We will hear in half an hour from now at 2 p.m. We will come to the highlight of this day, the pitches of the 50 European Young Innovators. So get yourself a quick lunch, coffee, tea, whatever you need to watch those 15 pitches, and we see you in half an hour. And if you already had lunch, then we meet you at the networking area. Thank you so much for all the panelists. Thank you, Sahar, and see you soon.